Hemorrhage control from start to finish. So if we were to have an external wound out here, of course the first method is going to be direct pressure, which we talked about. So if I had my gloved hand, I could put direct pressure immediately over the site, and then if I had the ability to get to some gauze, or my partner could get it for me, I could go ahead and put some gauze on there and hold some direct pressure as well. Okay, so whether that's a couple of 4x4s or if it's an abdominal pad, just depending on the severity of the wound. All right, so while I'm doing this, it's important that I also go ahead and make sure that I have good distal pulse. I can talk to the patient, I can ask questions while I'm doing this, and I'm gonna try to hold that direct pressure for just a few minutes to try to get this bleeding under control and get that clot to form. That's my ultimate goal here. Now, if this is just absolutely gushing blood and I absolutely cannot get it under control, I need to go ahead and progress with a tourniquet. Because remember, arterial bleeding is going to be bright red, spurting blood. Usually every time that the heart beats, it's going to continue to pulsate and spurt out. All right, if this is working, then after just a few minutes, I can go ahead and put a roller gauze on to create a pressure dressing. So what I would be doing for this is utilizing this rolled gauze. Now, just for simulation purposes, I'm going to use an ACE bandage so that it doesn't tear up, because these don't hold up very well to doing it over and over again. So whenever you're practicing, and I'm going to use this today right now. Okay, thank you. So I'm going to use the ACE bandage for that. The same concept is what we would do with the roller gauze, okay? So I'm going to come in and I'm going to take this out of its package. Hold that there for just a second. Thank you. I'm going to take this out of its package. And what I need to do is I want to roll from the hand or the wrist upward toward the body. Because if I were to start up here and roll down, it's going to cause blood trapping to start to form. So I want to start down here and roll upward as I'm putting this on. So I want to make sure that I have this put on for about 2 inches past the site of the wound, and then go 2 inches above. So I'm going to start down low and I'm going to roll this around as I come back around it the first time. Now I can come back down the second time and I'll be able to come back down. Now I'm not putting this directly over the joint because I'm going just where the injury is. Now when I come right here, what makes this a pressure dressing is that I'm going to rotate this. So flip your arm over for me for just a second. All right. If I twist this just one time, that's going to create pressure over that injury site. I could do that up to 2 times. All right, no more than 2, but I could do it up to 2 times to create pressure over that artery. Okay, now I could either take this down or I can just loosely tuck it in. I don't want this to be so tight that I've lost my distal pulse, so I definitely want to come back and check on that. Okay, now if this was working for a short period of time and then it progresses and now it's not and I need to move forward with the tourniquet, I could do that as well. Or if I went with the tourniquet first before this because it didn't control it. So we'll talk about the commercial tourniquet first. So this is blue because it is a trainer. So this is the cat tourniquet, and this is good for extremities, right? So we can put this on the extremity. I'm going to show you how to put it on. So we're going to open it up. What we want to know about the tourniquet is that we never want to put it on a joint. So we need to go 2 inches above the joint or 2 inches above the injury site. Now, where her injury is right here, if I went 2 inches above that bandage, it's going to be in the joint. So really, in this case, I'm going to go 2 inches above the joint. Okay, just understand where we're coming at with that. Now, I'm going to let her know that this is going to be uncomfortable, and if I haven't already, I could consider ALS coming to give some pain medication for it as well. This is just a trainer, it's blue, so it's not really going to hurt. Okay, all right. So I'm going to open this up and I'm going to slip it on here. If I had my partner here, if this wasn't controlled, we could apply some direct pressure until I could get the tourniquet on. But this goes pretty quickly. So I'm going to put it on and I'm going to make sure that it fits and Velcros down just like this. Now, this turnstile, I'm going to turn this until the bleeding stops. So this isn't actually going to get tied on her arm no matter how much I twist it because it's the trainer. But the traditional one would, okay? So it would get tighter each time that I twist it. Now, I'm going to twist this until the bleeding stops. That's the key, until the bleeding stops. So I might lose the distal pulse, but that's not my ultimate goal, right? Remember, if we're talking about a military setting, that is what they want, just because no blood flow could continue past that point. But here, you might lose the distal pulse, and that's okay, but it's not the goal. We're twisting until the bleeding stops. Once it's tight enough, I'm going to lock this into place in that little area. And now I could come back if I had this excess here and I could strap this down as well. Right here you'll see that it says time. I need to write the time on this area. Now some people would take it so far, and I'm going to show you this with the other one as well, that this might not catch anybody's eye. So a lot of times if people put tourniquets on, they will actually write the time on a piece of tape or either directly onto the patient's forehead. Okay, because anytime somebody comes back and checks on them, nurse, doctor, whoever, they're going to see that because they need to remember that this is in place once we get to the hospital, right? Once this is on, we should not take it off, right? Not going to take it off. If it were to continue to bleed for some reason after this is on, we could put a second tourniquet 2 inches above it, okay? If the patient has already made a tourniquet of their own, like from a belt, that's not something that we want to use, but if she's done that, then I want to put my tourniquet on above that, 2 inches above the one that she has put on, okay? So I've actually seen that happen with a guy who like almost cut his foot off with a chainsaw. When I got to him, he's got a belt tied around that area. We would put our tourniquet 2 inches above that. Don't take his off, even though it's not what we want to use, but still leave it on, okay? So that's it for the cat tourniquet. Now I'm going to show you how to do the stick and rod tourniquet. So if, let's say you have two extremities that need bandaging or for tourniquets, or you just, for whatever reason, need more. Maybe you are on the way back from a call where you used 2 tourniquets and now you get another one where you got significant bleeding, need to make one. Best option that we have on the ambulance is going to be the triangle bandage. Now you certainly could use another type of fabric, but you don't want to use anything thin. If you're using this triangle bandage, you're going to take and you're going to fold it. Doesn't want to be too narrow, but into some kind of thickness here. All right, a brand new one out of the package wouldn't be so wrinkly, but this is fine. So we're going to take this, same concept, not over a joint, but at least 2 inches above the injury site or 2 inches above the joint. We're going to come put this in. We're going to tie this very swiftly, just one small knot. Okay, so not double knot or anything. We're going to tie it just like that. I'm going to take something sturdy, so a pin, a stick, whatever I got that I can tie into this area, and I'm going to tie this down one time just like this. And now once I've done this, this becomes my stop, my wind style. Okay, so I'm turning this again. This is going to get tight, but I'm not going to turn it a bunch until the bleeding stops again. Okay, so once I've got this on here, I'm going to come in and I want to make this so that it's not going to move. So I need to tie this a couple of times around the ends, wrap it around, and then I'm going to kind of tie it just tight like this. I can come back underneath, I can come back over, just depending on how much fabric I have left, whatever I need to do to make sure that that stays in place. And now I can tie this 1 time, 2 times, tie it into a bow, depending on how much fabric you have left. Okay, same thing, once it's in and on, I would come back, I would check my pulse, I'm checking my bleeding, make sure that it stopped. If I had access to another tourniquet and I needed one, I could still go to above that, 2 inches above that, okay?